So what we're going to go ahead and do with our subject is we're going to take them through the FMS tool, which is going to be a functional movement screening tool. So did you want to go ahead and introduce yourself to everyone?
Hi, my name is Rio.
And I'm going to go over the criteria, what we're looking for after they perform the movement. So we're going to do an anterior view first, followed by a lateral view. So you want to keep that dowel nice overhead, and you're going to perform as deep a squat as possible. Okay, very good. Any pain?
No.
No. Okay, very good. If you don't mind turning to your side so we can appreciate a lateral view as well. Okay, very good. Are you comfortable holding this position?
Not for long.
Not for long. We'll go quick over this if you don't mind. A couple things we're going to be looking for. We want the upper torso to be parallel with the tibial shaft. So that's not bad, actually, if you consider the upper torso. I've got a little yardstick here. Hang in there. Whoops, getting tired?
Sorry, yeah.
No problem at all. That's fine. You can go ahead and put the tool down. Thank you. One thing we're going to look for is we want to make sure that the upper torso is going to be parallel to the tibia, which you did a pretty good job in. Another thing, your anterior view compared to your lateral view, so there's a little bit of a learning curve that I've noticed with this functional movement screen. You were able to perform deeper flexion on your second time. You're looking for that femoral shaft to be below horizontal. Okay, so there was an improvement in that femoral shaft lowering below horizontal on your second bout. Additionally, you want the knees aligned over the ankles or the feet, which you did a really good job at. All right, and then you want the dowel aligned overhead. So that was a trend that we saw. Typically, as you came down, the dowel did not necessarily maintain its position right over the ears. Go ahead and do you mind if I touch your knee?
No, go ahead.
Okay, so what you can do is you can kind of either eyeball it, but I prefer palpating to ensure, right? Go ahead and relax the knee if you would. That's perfect. All right, you'll find the patellar tendon. Just distal to that will be that tibial tuberosity, that attachment site. So I'm going to take this yardstick and measure it, right about, let's go ahead and make it right side up. That might help. There we go, at about 17.5. Thank you very much. So that's a little bit easier than eyeballing and guesstimating, because remember, they're going to be a little bit behind it. So I prefer taking direct measurements from the subject. We're going to go ahead and try to get that a little bit lower. So we're going to bring this down. Okay. Let's see, I'll bring this side down as well. Try to get that uniformly. Well, I at least use the middle since there's a little bit of slack in this line. We're working with what we got here. This is our DIY FMS system. All right, 17.5 exactly. So what we're going to have you do is I'm going to go ahead and move this forward because you're on a little bit of an incline. So we're going to have you with your toe right up to the board. So you have your feet nice and together with your toes flush to the board. Now bring your feet nice and together. Very good. And what you'll be doing is you're going to go ahead and lift the leg all the way up, and you're going to touch your heel down and then come all the way back. And you want to be clearing this line right here. And then of course we'll go over the implications following the exercise. All right, another thing is we're going to have you with this, like an overhead squat style, with the dowel just right overhand. All right, so you're going to be resting that. Make sure it's clear of your cervical spine. You're going to rest it around the upper trap. Okay, very good. So whenever you're ready, again, we're trying to appreciate symmetry or differences in asymmetry, right? So we're going to do test the left side, and then we'll test the right side. So you can start with whatever your preference is. Ready? Yep. Very good. Heel to the ground and back. Very good. Okay. And the left if you don't mind. Very good. Excellent. And then I'm going to go ahead and get a lateral view if you don't mind. So we'll just do this sideways here. Okay. I'm going to stand here a little bit. Oh, okay. Thank you. There we go. Very good. And you can let your heel just make contact. very good. Thank you very much. Did you experience any pain?
No.
Okay, good. I'm gonna go ahead and get this out of the way. Very, very nice. So I'm not gonna give them too hard of a job, too hard of a time on making contact because it's a little bit flimsy, that string. So for this, I would go ahead and assess this as a 3. That's perfect. Okay, and we're gonna use the measurements that we took from the tibial tuberosity measurements and apply it to this. So if you remember, they were 17.5. So your opposite heel is gonna come right about halfway between 17 and 18. There you go. You want both feet nice and flat. All right. Now for this, the dowel, it's gonna be the opposite arm. So you have the left leg that's gonna be in front. So the opposite arm, the contralateral arm, is gonna go ahead and perform that flexion all the way up. So you're gonna place the dowel right behind your back. That's perfect. Okay, very good. And you wanna maintain inline contact. Oh, you got a bun, that's right. You wanna go ahead and try to maintain contact with the dowel. 2 points the back of the head, right? Spinous processes all the way down to the sacrum. And what you're gonna go ahead and do is you're gonna just perform that inline lunge. Okay, take your time. All right, whenever you're ready. Very good. Okay, excellent. And then do you want to go ahead and swap legs? So we'll do lateral view of the left and right side while we've got the lateral view. Okay, very good. And of course you can use that as a cane if you need to set yourself up. There you go. So that's going to be opposite, that's right. So you're going to flex that left shoulder, exactly. Okay, you're going to maintain that flush to the body the whole time, nice and tall. And okay, whenever you're ready. Okay, very good. All right, any pain?
No.
Okay, we're going to go ahead and do one anterior view if you don't mind. All right. So we're just going to So now you can appreciate them from a lateral view as well. Just kind of save us time, we'll do just one side so we can get through the rest of these. Nice and tall. Very, very nice. Thank you very much. No pain?
No pain.
Okay, good. So a couple of things that we're looking for, we want to make sure that that dowel is maintaining contact at all points in the body, right? So we've got the dowel all the way up here, back of the head, along the thoracic spine, sacrum, right? Maintaining that dowel close to the body. We also want to make sure that they're able to resist any movement of the torso or any wobbling, which you did a very good job in all three. Or actually, I should say all. I prefer to start with. Actually, you know what? Not quite yet. I don't know what I'm thinking here. Forgive me. You're going to go ahead and actually, with your thumbs in, just make a grip, just like that. That's perfect. And whichever hand you prefer to start with, you're going to bring one hand on top and one hand on bottom. Okay, just one time. Once you've got that position, go ahead and hold it. And you want to avoid inchworming the hands closer together. Okay? Very good. Very good. Right like that. That's perfect. So on our dowel, we've got little measurements that are marked here to take this measurement. Okay. So here we are. All right. That's perfect. Okay. So we're within 7 on this side. And we're going to go ahead and have you swap to the other side. Remember, we're going to be testing each side individually. All right. Let's see here. Now here, and we just barely make it right there, actually. So for this, from here to here, from hand to hand, we're actually right at about, if I'm being honest, we're right at 11 inches. So that's going to be outside of that hand and a half for them. Remember we did hand and a half, was at about 10.5. So at 11 inches for this side, this is going to be a 2 on this one, right? With the right arm. And then, flex overhead. And then it's going to be a 3 for left. You played volleyball, right?
Yeah.
What was your position?
Outside hitter.
Outside hitter. Are you right side dominant?
Yes.
Okay. And any injuries?
No.
Anything like that? Any pain during that exercise?
Yes.
You had pain?
When my right arm was under it.
Was under. Okay, so going through internal rotation.
Yeah, it hurts the shoulder.
It hurts the anterior shoulder. Okay, okay, understood. So with this, a couple things we're assessing is obviously bilateral range of motion. This exercise is going to take them through all the planes of motion. As we know, the shoulder permits the most range of motion and flexibility, right, through all of the joints in the body. We talked about wanting to be able to fit them within 1.5 hand length, right? So following this, we're going to go ahead now. Did you only have pain on for one?
Yeah.
Okay.
The right one when it's under.
Okay. And when you had it over, did you experience any pain?
No.
Okay. So for one of them, for that right one, when it was under, you said during internal rotation, it's going to be a 0 because they had pain with that. All right. The other one was going to be mentioned was going to be a 1, but with your combined values, the lower one is going to reign supreme. So it's going to be a 0 overall. So what we'll follow this up with is going to be the shoulder clearing test. So for that, and again, we want a bilateral appraisal. You're going to go ahead and you can face forward just like this, and you're going to just rest your hand on your opposite shoulder, all right? And you're going to go ahead and elevate the elbow, maintaining contact with your shoulder. Okay, very good. And we'll go ahead and do the opposite. Okay, very good. Do you have any pain? No. Okay. So for this is going to be negative tap. Okay, so with that, ASIS, midpoint of the patella, halfway point. We'll do the same thing for the opposite side, whenever you're ready. All right, very good. Any pain?
No.
Okay, go ahead and relax. Okay, so what we're looking for is we're trying to see if that malleolus of the ankle is able to clear the dowel. Patients, we're going to bring the thumbs just parallel to the chin. All right, so we'll bring your thumbs if you don't mind. You're just going to line them up with your chin. Okay, that's perfect. All right. So from this position, we're going to have them perform a push-up. What we're looking for this is we don't want this movement to be segmented. Everything should be moving up together in unison as one single unit. All right. So go ahead and you can get ready to prep for your lifting up. There you go. Perfect with the ankles. You're going to perform a push-up from the down position all the way up. All right? Whenever you're ready. So we're going to look to see that everything is in unison. Now you're straighten your knees out. There you go. Okay? Whenever you're ready. Very good. Okay. No problem. Go ahead and come back down. All right, one thing that I noticed was we did start to see more of the lumbar spine start to perform a little bit of extension. We saw a little bit of sagging, and also there was a little bit of rotation where you saw one side also start to lift up before the other. All right, so what we can do to modify this is we can bring the thumbs. All right, we have them up at the chin. We can bring them closer to the clavicle. We'll line them up with the clavicle. It's a modified version. Are you experiencing any pain with this?
No.
Okay, so we're going to have the thumbs line up with the clavicle. So bring your thumbs right here. So right about here where your thumb, right there you go. Perfect. You want everything nice and contracted as a tight unit. Extension of the knees, very good. We want everything to move up together whenever you're ready. All right, very good. Any pain? Good, go ahead and relax. That was a little better. One thing we saw, if you're looking from a superior view, you can appreciate the hips. From a top view, they did move up together, so it wasn't tilted to one side, but you could still appreciate that there was a little bit more segmentation than we would like to see, right? Where we saw that thoracic extension or that lumbar extension come up with the torso leading as opposed to the whole body moving as a unit. All right, so for that, they were able to perform it, but they did demonstrate a few compensations, both at the standard and the modified version. So for that, we're going to go ahead and give them a 2 on that. The next thing we'll do, we'll keep you in this position real quick, is going to be the spinal extension clearing test. So if you're familiar with yoga, I believe this is similar to the cobra pose. So what you're going to go ahead and do is same thing, your hands by your side like you were in the push-up position. There you go. You're going to keep your right anterior groin and your legs flush to the floor, and you're just going to lift the chest up until you get full extension in the elbows. All the way up, full extension, very good. Any pain? No. No pain. So for that test, it's going to be a negative. Okay, much better. Can you bring them back? Okay, very good. So what we can try, go ahead. Go and try to bring that right hip down a little more. You can't. Okay, no problem. There's a modification to this. So what we can do is we're actually going to do contralateral. So what you can do is you'll be extending your left shoulder and extending the right hip. All right, and then you're going to bring them back together to touch. Very good. 3 times. And those hips level. All right, so we're activating glute, hamstring, right? We're looking at core stability. Very good. And if you don't mind, the opposite side as well. Very, very good. Okay, with that, they did much, much better when they did the contralateral limb motion. But despite that, that's going to get a 2 on the scoring. What we'll do is we're going to keep you in the quadruped position, and if you're familiar with yoga, you know child's pose, where you kind of lean forward, you're going to lean your hips back and extend your shoulders forward. We're going to have you just kind of lean back with your rear end on your shoes. Yep, just like that. Okay, do you have any pain?
No.
No, okay, thank you very much. All right, so for that, that's going to be a positive or negative test. Remember, our criteria for that is going to be symptom-based, so it's going to be if they report pain or not. So they reported no pain, so that's going to be a negative.